Dislocation of the ankle.
Oh! What up? I'm checking out the Pitt. Let's go. I'm excited. My friend did not stop recommending this show. I'm so excited for the show. Hour 1. As far as I know about this show, it's like it's going hour by hour each episode, that's a cool concept. Hopefully the hype is lived up, because a lot of people said like this is gas.
Is it true? Simi told Hector that Dr. Durangian said the hospital was up for sale.
They might turn it into an ortho center with no ER.
Oh, they're always threatening to shut us down, but they never do.
Ano, niniwala ka sa kanya?
Hindi ako nagtitiwala sa mga doktor.
Gloria is looking for you.
No guts, no Gloria. Must be time for my weekly spanking.
It'd be nice for all our sakes. You sure you're cool being here today?
Yeah, why wouldn't I be?
Well, if you need to talk.
Yeah, I won't, but thanks.
This looks like a hospital though. I gotta say, like even the Excel sheet and everything, it does. The monitors, the weird fucking what do you call those? This columns. Went to college, baby. Went to college.
Where's Abbott?
It feels like a real hospital.
Getting some air? You okay in there?
Awesome.
I like to say it goes away, but I had morning sickness for 6 months with my second daughter. Hell, who am I kidding? That one still worries me sick.
Thanks.
It was worth it. You tell anybody yet?
Oh, no. Not until I passed 12 weeks. Not this time.
Nothing but good vibes. But just so you know, Robbie's working today. Today's the day Doc Adamson died. He hasn't worked it in 4 years.
So why is he here?
All I know is he still blames himself for Adamson's death. So if he's a little prickly today, give him a pass, okay?
Great.
Thank you. Hang in there, kid.
Question. This has nothing to do with the show, but do you want to have kids? Genuinely. I'm asking, do you want to have kids? If you had kids, my bad, bro. I'm sorry. But if you have the option, would you want to have kids? Yes or no? Honestly, after I saw the files dropped, I've been spending hours just reading it. And the horrific shit that I saw in it, it made me like, yo, maybe the future is not meant for a new generation. We should end this right now. You know what I mean? I feel like if this is the best we can do in society, I feel like we fucked up. Dark, I know. It's been on my mind, bro. It's fucked up. Talking about Epstein, by the way.
Morning, Jack.
What are you doing here?
I'm working. And you?
Smoking.
Oh, I don't know. Had a guy come in, hit by a drunk driver in a crosswalk, 39-year-old vet. Survived 3 tours with a scratch. I spent the last 2 hours coding him.
That's always a rough way to end the night.
Must have had a reason at one time to keep coming back, but I can't think of it right now.
Because this is the job that keeps on giving. Nightmares, ulcers, suicidal tendencies. Besides, if you jump on my shift, that's just rude, man.
True. Valid. We all have those thoughts, but not on my shift, dog. Not on my shift.
Hope I'm never one of your patients.
That makes 2 of us, my friend.
Oh, and you got the med students and new interns starting today, so good luck with that.
Lucky me.
Sir, come back here.
No more needles!
Oh,
Sir!
No more needles!
Stop!
sure you want to work today, huh?
They're gonna hurt me!
Sir, I promise nobody's going to hurt you. Sir!
Does that happen? Some of you must be in the medical field. Does this happen? You know what I mean? Like, I always see it like in movies and TV shows where a psych patient just runs out butt naked or something. Does that happen? Never seen it.
Who left this mess?
They had a rough night.
Good morning, sunshine.
You obviously haven't seen this board.
Ah, we've seen worse. Nothing like a little challenge every now and then to keep everybody on their toes.
Dr. Rabinovich? Melissa King. I will be joining you today. I just came from 2 months in the VA.
Hey, welcome to Pitt. This is Dr. Jack Abbott.
Nice to meet you. I can't tell you how excited I am to be here today, so.
Talk to me at the end of the day.
Ignore him. He had a rough night and is having an ongoing existential crisis.
Don't worry. You'll get there soon enough.
Make sure they're not dying. If not, they're moved to one of 2 triage rooms for vitals and a quick chair exam where you can run your labs and your x-rays.
And then they come back to...
Waiting room till the bed opens up.
For how long?
8 hours if they're lucky. A lot of times 12.
Is it always this busy?
No. It gets a lot busier. Me today, do you mind if they observe?
Sure.
Okay. What's going on, Sherry?
I burned my hand on a sterno.
What are you doing with the sterno?
Cooking.
You were cooking with the sterno?
We were making s'mores.
Sweet. My son loves s'mores.
We've been here for hours and I have to get them to school. Do you know how much longer this will take?
Yeah. Let's see. You take anything for the pain?
Not yet.
1,000 of Tylenol, 400 ibuprofen, and the saline dressing?
Yes, please.
Okay, we're going around.
And the fun begins. All right, Sherry, we're gonna patch you up and get you out of here as soon as possible, okay? I'll be back.
As you can see, we have some new faces with us this morning. Good morning, good morning. Come on over. Starting with second-year resident Dr. Melissa King, fresh from the VA.
Everyone calls me Mel. I'm so happy to be here.
Trinity Santos, intern.
Victoria Giavatti, MS3.
Dennis Whitaker, MS4.
Welcome to the Pit.
We got 2 traumas from the T, 5 minutes out.
Okay, copy that. Actually, this is the most important person that you're going to meet today. This is Dana. She's our charge nurse. She is the ringleader of our circus. Do what she says when she says it. As you can see, our house is always packed, and our department is mostly clogged up with boarders. Those are admitted patients waiting for a room upstairs, sometimes for days.
Damn.
Beds are a very precious commodity around here, so please be quick and efficient with your workups. What else? We treat the sicker patients back here, but please keep your eye on that waiting room. Make sure nobody's gonna die out there. Your senior residents are Dr.
I know her
Collins
from somewhere.
and Dr. Langdon. You report to them, and they report to me, okay?
The white chick.
Great. Senior residents, you got your sign-outs?
Yep.
Yep. Okay, let's do this.
Virgil
glasses one.
Straker, 9mm GSW to the left shoulder. CT angiogram negative. Surgery wants to admit for overnight observation.
Good vitals. They repeat a crit?
Stable crits every 2 hours times 3.
Discharge on Sefton. Recheck tomorrow. He'll get way more rest at home. Good morning, Mr. Straker. You want to go home?
Hell yeah.
Okay.
Hey, bro.
Hey, Doc.
And we all know Louis Cloverfield. Blood alcohol of 420 at 11 p.m.
Damn.
Cutting back.
How is he still breathing?
That's a lethal dose for you and me. That's happy hour for Louis.
Sobered up, had 2 rounds of lorazepam.
Hold out your hands for me, Louis. Nothing to lorazepam.
On it. And a script for Librium.
It's good to see you, Louis.
It's always a pleasure, Doc.
Bar fight with complete avulsion of tooth number 8. Smile, Charlie.
Oh, where's your tooth, Charlie?
Fuck if I know.
Sam Wallace, blunt head with agonal respirations. Dropped down the T-tracks. Couldn't tube him, LMA in place.
Suicide attempt?
Rescue. He's a good Samaritan. Took a spill helping a woman who fell off the tracks. She's right behind us.
Okay, trauma 1, go ahead. Come on.
Woman fall from T platforms. Good vitals, no head injuries. Degloving injury, right lower leg with open fracture, dislocation of the ankle.
Oh!
Trauma 2, let's go.
Ew.
How we doing, ready? Okay, here we go. Ready? 1, 2, 3.
Good breath sounds bilaterally, but we need to protect his
Apparently, he jumped down to save the lady. When he climbed back up, he slipped, fell back, and hit his head.
Thanks.
It's more of an R2 procedure. Mel, right? I need you on the E fast. Pupils, 4 millimeters, and reactive.
Okay, that's encouraging.
What do you want for meds?
120 ketamine, 80 of rock.
AFib on a monitor.
Morrison's clear.
That's a lot more blood than expected.
He's probably anticoagulated for AFib. Check his medical record, see if he's on a DOAC. Standby with 4-factor PCC if there's a brain bleed.
What's with the PCC? No.
Clotting factors 2, 7, 9, and 10.
Okay, be right back.
50 of Fed, didn't touch her.
Did she faint or did she trip off the platform?
Nobody knows. The other guy jumped down, pulled her off the tracks just as the train was rolling in.
All right,
Ma'am,
top
what's
3
your
open
name?
fracture, 2 grams, cephazole,
Do you
and
speak
4
any
hydroxy.
English? Airway and breathing are perfect.
As his circulation, BP 140/85.
Students,
20 cc's of
what might have made her faint on the platform?
Could be an arrhythmia, cardiac event,
So she needs
EKG, and a troponin.
Okay, good.
Got pretty people.
subway train degloved your foot with an open fracture dislocation.
Ooh, and I thought my heels were painful.
They're dynamically stable.
fast negative.
Ma'am, I'm Dr. Yolanda Garcia. Any pain in your chest or belly? Can we please push the morphine?
No, it could cloud her mental status.
I can't do an exam like this. Push the damn morphine.
We're doing a popliteal block. Numbs the lower leg, no side effect.
Here are me nodding like, yeah, that's what she's supposed to do. I don't know shit, bro. I love that I caught myself. Like, yeah, that's what you're supposed to do. Dog, I don't know.
Wonderful. Where's the other guy?
Next door. He's a bit worse.
Pan scanner, let me know when she stops screaming. The cords are very interior.
Yeah, that's because we can't flex the neck. Keep the hockey stick straight up.
Oh, that's the mouth. I thought.
I'm in.
Good. Well done.
Bring me up to speed.
Intubated for agonal respirations, GCS5, probably anticoagulated.
With what?
First time here, there's no medical records.
Call for FFP?
No, we got 4-factor PCC.
80 of mannitol to reduce brain swelling, then right up to CT.
Hey, do me a favor. Swap out with Jesse for me. Would you?
Of course.
Dr. Rabinovich, do you have a moment?
I'm just a little busy right now, Gloria. 1 sec.
This is an idea for any app developers out there. Why isn't the medical records directly into the phone? You know what I mean? Like, why don't you like use one app that connects to every like hospital? We have it over here, right? Like your medical history is just in the app. Why don't you have it there? That's crazy. Get with the times, damn!
Block complete.
Seems like it's starting to work.
Swapping out Jesse.
Takes 10 minutes for the full effect, and Marcane lasts a good 4 hours.
She's next for CT.
You have any idea what language that is?
Oh, definitely not Tagalog. Maybe Hindi or Urdu.
May have been pushed.
Jesus.
Yeah. Could be looking at a possible hate crime.
I take it you're free now? We need to talk about your numbers.
People we've saved.
Metrics.
Our door to balloon times beat federal standards.
I'm talking about press gaining scores. Patient satisfaction.
If they're still alive, they should be satisfied.
Our goal is 36% very satisfied with their care. Your department is at 8. Do you know how likely patients are to recommend this hospital?
This is an emergency department, not a Taco Bell.
11%.
Well, if you want people to be happier, don't make them wait for 12 hours.
There's a nursing shortage across the country.
Most of our patients are boarders who are waiting for a bed upstairs.
We don't have the beds.
That's bullshit. The beds are up there. You just don't want to hire the staff you need to care for.
Oh, Doc, it ain't working. And whatever they're giving me, it's not working.
No response to max citrate. Should I send in the fleet? Okay, sir, we're gonna try an enema.
Like I said, there's a nursing shortage.
Well, if you paid them a living wage, they'd be lining up to work here.
Our budget can't support that.
Oh, here's a dirty little secret. The hospital saves money keeping patients down here in the pit. It's way cheaper than staffing upstairs.
I have asked you repeatedly to stop referring to the emergency department as the pit. It is derogatory and incompatible to the institution's image.
You know what's incompatible with the institution's image? Me speaking to the media about people who code in our waiting rooms and people who get shitty care in our hallways waiting for an ICU bed for days.
I've heard about doctors who have tried that and find themselves out of work. I know today is difficult for you.
Every day is difficult down here.
Boarding is a nationwide problem. Your predecessor, Adamson, sure as hell knew that. Or wasn't that something he taught you?
Fuck. Wow. Really?
Yes, really. Other hospitals are managing this crisis much more effectively. So you can either step up your game or you can step aside.
I hate that so much. Whenever like a manager says, "Oh, other people did it. Other people did it. Then why don't you just do it? Like it's so easy. They made it work." Dog, you have 3 seconds away. You have 3 seconds to get the fuck out away from me before I kill you, dog. Before I kill you, dog. I had a manager just like that. I told him, dog, hire more people. We need more people. He hired another manager. Dog, how dumb are you? We don't need another manager. We need labor. We need the groundwork, bro. Nurses, laborers, the people that make the thing work. Those are the most important people. Managers are not important. I'm speaking as a manager. It's not important. We barely do anything. We just make sure things like flow in certain direction. That's it. And paperwork. 90% of the time, the work is done by the laborers, the nurses, the people that you don't give a shit about. The people you are not willing to give them a single penny more. I'm not talking about like they're being paid like $10,000 a month. They're being paid below minimum wage. And they think to themselves like, should we pay them more? It's crazy. You bitch. You bitch. Sorry, that brought up some trauma in me. Going back.
Good Samaritan dude has a small left temporal intraparenchymal bleed. No epidural, no subdural, no midline.
I know her from somewhere. This girl, right here. I know I'm stopping a lot. I know. But this is a hangout, you know? We chill. We have fun. We talk about your day. What's up with you, bro? Actually, I don't care. Skip. I know her from somewhere. She did some movie. Star Trek. Thank God. Picard. She played like a cyborg. I loved her in that one.
Ripped in the brain.
That's good news.
It would have
Recover.
annoyed
CT
me.
can take her in 5. Let's have a look. Bandage scissors.
All right. If an artery is totally transected, the smooth muscle in the tunica media contracts with hemostasis.
But if it's a partial cut, get out your umbrella.
Grab a culture from the open fibula before you reduce. You're up.
I'll stabilize the knee for the reduction. Dr. Langdon will be distracting distally before moving medially to clear the tibia. Good. Ready?
Ah! Yeah. Valid.
Med student down.
Don't be like that. Don't be like that.
The catch
It's
on board
valid.
by Billy. There's an aspirated tooth on chest x-ray. Would have been dead in a week from a lung abscess. They should let him be discharged.
We're calling the pulmonary.
Cardiac arrest, TTA, 10 minutes. Where should we put it?
Anywhere.
Is that the weekend?
Might have to put somebody in the hole.
Dr. Robbie, she took a fall.
I tripped on the gurney. I'm fine.
Yeah, it's valid.
Why don't you go get a cool drink in the staff lounge?
I'm fine, really, I swear.
Oh, I know, but it's hospital policy. Anytime someone gets a paper cut around here, we have to fill out a workers' comp report.
Damn. When your body betrays you.
I was fine until about 2 weeks ago, after the Rochester Marathon.
Okay. Any falls or injuries?
Just tired, sore muscles.
Yeah, I'd be in bed for a month. Was this your first triathlon?
God, no. No, I do one every few months.
Have you seen a doctor yet?
No. I went for a run this morning. Had to quit after a minute. Pretty short of breath.
This goes under your tongue. No current meds, no allergies.
We're gonna check a few labs and an EKG. Draw red and purple top.
Yep. Temp 98.2.
Damn.
Take a deep breath for me, Otis.
Little pinprick now, okay?
Otis? Otis? Didn't take him for a lightweight, huh?
Oh, shit. No pulse. Crash cart laying flat.
What happened?
Let's check a rhythm.
Saline pads. Quick look paddles.
VTech.
Charging at 200. Charge.
Clear.
All right, he's back to normal sinus. Need a gurney in here.
So what's the plan?
I see you when you can get a bed and admit for supportive care. Repeat head CT in 3 hours. Or sooner, if he blows a pupil.
Want a Keprolo?
Order's already in. Nice job.
Do you think he'll wake up?
Maybe. Maybe not.
No good deed goes unpunished.
That doesn't fit in this scenario, Doug.
Oh, has anyone notified the family? I could try.
Otis Williams, healthy
I already like this
31-year-old
girl.
VTAC arrest 2 weeks after triathlon. NSR with 1 shock.
Pulse 98, BP 110/60.
He's a little young for mine.
Exactly right. What's the differential, Dr. Collins?
Drug overdose, electrolytes, on QT, Brugada syndrome, WPW.
How you doing there, Otis?
Okay. What happened?
VTech again?
200 joules.
Charged and clear.
Back in sinus. Otis? Otis?
Oh, Broning's good. 5 of nasal O2 CBC, CMP, troponin, and D-dimer. What are you doing?
1 gram calcium glutamate, IV push.
We don't have the labs back.
Look at the monitor. Wide QRS and peak T waves, hyperkalemia.
How do you get that?
Intense exercise caused muscle breakdown, rhabdomyolysis, knocked out his kidneys. Now he's not clearing potassium. I bet it's over 7.5.
Wait 2 minutes for the ice.
If you rescue him, we might not get him back.
It's like calcemia, you could kill him. Wait.
It's my ass, not yours.
He's confident, but not cocky. I like that.
Pan scan is negative. That means you can admit to orthopedics.
But there may have been a medical etiology if she fainted.
That's not surgical. Get an internal medicine consult or admit to medicine with ortho consulting. Either way, I'm off the case.
Okay, thanks for nothing.
And Sin, I'll grab the chant.
Did we figure out what she's speaking?
Last interpreter thought she might be from Pakistan.
There are 77 languages in Pakistan.
Okay, well, I
Actually,
will buy
just
lunch for whoever figures
one.
it out. Good luck. If you need me,
The
I'll be
main
saving
one.
lives.
That was wicked.
That was gross.
Yeah, too much for little Miss Crash and Burn. What'd you do with her?
Nothing. I think she'll be fine.
You kidding? If that took her out, she'll be lucky to make it through this rotation. I got $50 so she doesn't last through this shift. Come on. Put your money where your mouth is.
No, I didn't say anything, okay? I sure as hell don't have $50. I'll be this lady's age by the time I pay off my student loans. Not that you...
Hey. You want to sell a kidney? I could get you $30K as soon as this weekend. That's just between you and me.
30K though is not much, right? Like, it's not much. 30K, would you do it for 30K? Like 30K for a lifetime of drinking water constantly? Nah, dog, I'm good. I'm good. 30K is not that much. Before it was. Now I feel like 100K maybe. 100K. Yeah. You know? If you can buy a car for 100,000, you can buy a kidney for 100K. I mean, come on. It's not me, it's the market.
Think about it.
We can negotiate, but 100K is the starting point.
How you doing?
Oh, my chest.
Yeah, we had to shock you. You're gonna be sore for a while.
You shocked my heart?
Long story. Dr. Collins will fill you in.
Damn, she's mad.
You guys sick? You okay?
Why wouldn't I be? Are you okay?
Why wouldn't I be? You seem annoyed with me already, and I just got here.
Ooh, T.
Not always about you, Robbie.
Come on. That was a clutch. That was a clutch. You can hate. You can hate. I get it. That was a little bit reckless, but that was clutch. Game recognized game. That was clutch, dog. That was clutch.
Am I gonna be okay?
No, dog, you're
Yeah.
fucked.
You just need to take it easy on yourself. Muscle breakdown and myoglobin damaged your kidneys.
Why did you shock my heart?
When your
We
kidneys
liked
don't
it.
work, potassium builds up and messes with the electrical activity in your heart.
Can it happen again?
You know, we gave you medicine to lower your potassium, and you'll need dialysis to clear it all out.
Then I'll be okay.
Yeah.
Damn, that's
You
good.
might need a week or two for your kidneys to recover, but yeah. You really need to hydrate like crazy before and after a triathlon.
Trust me. I won't let this happen again.
Good. Be kind to yourself. Okay?
Be kind to yourself. Stop being a dickhead.
Old woman from a SNP. History of emphysema, CHF, MS, VFib, unresponsive to 3 shocks, 2 rounds of epi.
What is that?
Lucas chest compression system.
Robotic CPR.
That's nice.
We're gonna get a hold. 1, 2, 3.
Students are dropping like flies.
Take a break, ice the finger.
You can count on getting a couple elderly patients every day around 7:30 after the nursing homes and assisted living facilities do their morning bed checks. You can practically set your watch.
Was there an advance directive?
No, full cope for the nursing home.
Seriously,
Lucas off.
still VFib.
Lucas on. 1 more round of epi, 1 more shock, and then we call it.
Stop. Call it. Nursing home just faxed us a DNR.
Kidding.
Power out the defibrillator and the
Complete
Lucas.
waste of time and money. Who the hell works at that place?
A nurse taking care of 60 patients who couldn't find the form.
She called 911 so she could take care of the others.
Okay, let's move her to the viewing room and notify the family.
Yeah.
One of the things we do here is to take a moment of silence when we lose a patient. To respect their humanity and also to remember that this was somebody's child, or sibling, or parent, friend.
Abaco and Diaz, my friend. That is my luck. That is
Maybe
me.
leave it on vibrate while you're working?
If there was like a representation of my luck, that dude is. I have the worst luck when it comes to like situations like this. Always.
Later, Doc. You behave yourself now. Always.
I just wanted to apologize for any trouble my clumsiness might have caused.
I feel ridiculous.
Oh, I can't tell how many times I've hit my head on an overhead lamp. Twice I needed to get staples. Why don't you go work with Dr. McKay in triage? That would help both of us.
Oh, I don't need special treatment.
Good, because I don't give it.
Look, I know I might look too young, but I studied my ass off to get here. Probably harder than the others. I earned this.
Okay, look, I respect your dedication and your determination, but while you're here, you're my responsibility. And when one of my responsibilities takes a header... Wow! Abbott called for a surgical consult on the SBO 3 hours ago. You're very lucky they didn't perf.
I'm here to see my daughter.
I'm sorry, is that a patient?
You're talking to her. Am I interrupting? How's your first day going?
It's great.
Yeah?
Yeah, really great.
Hey, Crash. They're doing a dialysis catheter insertion in North 1 if you want to check it out.
Mm-hmm.
Did
Thanks.
she say crash?
No? No, it's not crash. She said crush, because I was crushing it. Thanks for coming down, Mom, but I've got a patient. Bye.
I have a theory, right? The theory is this. I think doctors are just traumatized people. Meaning, your father was traumatized, so he traumatized the child. The child was traumatized, so they traumatized the children. I feel like doctors in general, just a descendant of trauma. You know what I mean? Because why would you take this job if not for trauma? Knowledge, bro. Knowledge. Like if your dad or mom does not work in the...
What do you want?
I just wanted to make sure you're comfortable.
I am taking a dump in a dustpan. So what's that fucking tell you?
I'm clearly in the wrong room. Yeah. I'm sorry.
Mm-hmm.
He's not usually this sleepy?
No, and he barely flinched for the blood test.
He wakes up at 90 miles an hour and doesn't stop till he passes out at night.
He passes out?
No, he just means he goes all day.
Any chance he could have ingested something? Any pills, vitamins, any prescriptions that may have been left around?
No, that's all kept locked in the medicine cabinet. The whole house is childproof.
What about
Not
alcohol?
ours.
Anything left?
Not my house. Nah, we keep the medicine in the fridge right on the door. So any child can reach in and have a snack. Dog, something hilarious happened to me. My mom, I was like, man, my back is hurting. And she was like, don't worry about it. She came back like 2 minutes later with 2 pills, right? Out of the wrapper. And she was like, take these. And I'm like, dog, no. I don't know what this is. This is our family. Survival of the fittest. You are responsible for your own health. If you take it, you're responsible. If you don't, you're responsible. You know what I mean? I gave you the medicine. You see how we twist it? Yeah.
No. What about pets? No.
You say he's usually like quite active.
Very.
Any injuries lately?
No.
Hasn't bumped his head recently?
Not that I'm aware of, but he does love rough housing with Drew.
But he never gets hurt.
Oxygen level is normal. Good pulse and blood pressure. No signs of infection. We're going to start with blood and urine tests. Check for any metabolic abnormalities.
It's really throbbing.
Yeah, the blood's under pressure. Gotta drain it.
No anesthesia or?
Oh, stop before I hit the nail bed. I hope.
That's a big ass needle.
Hey, eyes down here. Watch and learn.
I'm just looking who to see next.
We're supposed to take them in the order they arrive.
Yeah, I know how it works.
Okay, no need to cry about it. Do you want me to choose for you?
No.
Ooh.
Wow. Pain's gone, thank you.
All right, how about a 20-year-old cough in 8? Should be easy, probably viral.
I don't need an easy.
Suit yourself, Huckleberry. I'm gonna take the splitting headache. Maybe I'll catch a subarachnoid hemorrhage or something cool.
Hey, why do you keep calling me that? Huckleberry?
It's a term of endearment.
It sounds like sarcasm.
You think?
Bordering on harassment.
Where are
Don't
you
be a
from?
bitch.
Broken Bow, Nebraska.
Jesus, where the hell is that?
It's about 3.5 hours west of Omaha.
Oh yeah, just a little south of nowhere.
I'm so sorry, ma'am. We don't understand you.
Do Google Translate doesn't exist here? What's up? Just pull out your phone and just put it next to her mouth. It's not that difficult. It has elements of Hindu. It has elements of Nepal.
Me? I'm Dr. Heather Collins. I'm from here, Portland, Oregon. You. Where are you from? Uh-huh. China? India? I can't tell where you're pointing. Tajikistan?
Nepal! Nepal! I said it, dog. I'm linguistics like that. I'm linguistic like that.
You're from Nepal.
Nepali.
Mom's got a bad burn, needs wound checks and hand therapy, and
Damn!
I have a sneaky suspicion she may be unhoused.
I'll talk to her. We can offer some help.
Thank you. I appreciate it. Ah, you're back.
Dr. Robbie suggested I might be of assistance?
Yeah, I could use the company. Victoria Javati, this is Chiara Alfaro. She was a department social.
I like how this is kind of like a one shot. I mean, it's not a one shot, but it feels like a one shot. Like it's non-stop. Everything you got to keep your mind on, like it feels like a job. It feels like a job when multiple shit is just on fire and you just want to get through the day. You just want to get through the day because you're tired. You're done. You're thinking about quitting. You're thinking about killing somebody. Maybe that guy who's been giving you the stink eye for like 3 days. You don't know him. You don't even know his name, but you just want to be like, what are you looking at, bitch? I got shit to do.
Can I actually ask you a personal question?
No, I'm good.
I'm 20 and I've earned the right to be here.
Oh, yeah, I don't doubt that for a minute. I was actually wondering if Dr. Eileen Shamsi from surgery is a friend or relative of yours. I saw you talking to her in the hall, and I
Yeah,
thought
she's
that
my mother.
Oh wow. Oh, that's cool. You're really only 20?
Yeah. And for the record, my father also works here. He's an endocrinologist.
Oh, so it's like a family business. I'm sorry, that was a joke. That was a joke. And I'm sure that comes with a lot of pressure. And as for the age thing, I'm a 42-year-old R2, so I have my own haters, trust me. Okay. Sometimes when it gets busy, we'll help the nurses bring back patients.
Okay.
She's 42?
Okay, next to come back is Fred Saida, knee pain after a fall.
Great.
I thought
Doc,
30.
hey,
now.
Doc. Hi, Doug Driscoll. Any chance someone could see me now? I've been here for like 2 hours.
Unfortunately, Mr. Driscoll, there's a lot of patients still ahead of you, some of whom are severely ill.
Yeah, and I got chest pains that woke me up in the middle of the night.
Chest pain.
Yeah.
No, it's not plural. It's just chest pain, not chest pains.
Yeah, and if I have more than one, it's chest pains. Are you even a real doctor?
She's a student doctor.
Yeah, well, keep her the hell away from me.
Your name? Excuse me. Fred. Actually, can you get me a wheelchair, please? Hi, I'm Dr. McKay. What's going on?
Oh, I found her on the floor in the bathroom. She can't stop puking.
What's her name?
Teresa, she's my mom.
Hey, Teresa? Teresa, are you taking any medication? No. Any previous stomach problems? No. When did the vomiting begin?
Last night.
Do you have any dizziness or fatigue?
Mystery solved. Our lady with the degloved foot is Nepali.
Oh, hey. Congratulations.
Otis's BP is crashing, 70/50, still waiting for dialysis.
How you doing there, Otis?
Okay, that's okay.
15 liters non-rebreather, please.
Oh, crap. Diastolic collapse of the right atrium and right ventricle.
Tamponade from uremic effusion.
That's why his BP is low?
Yep.
Too much fluid and pressure around the heart. Chambers can't fill.
Otis, you got some fluid around your heart. We need to get it off.
25 in propofol, 10 cc's of lidocaine with epipericardioccentesis tray.
I have to get them from
No,
Central.
just open a central line, kid. Dr. Santos, take the head of the bed and bag him if he stops breathing. Compressions if we lose the carotid. Prep and drape the subxiphoid, please. 10 cc's of 1% width.
Chlorhexidine here, 25 or 27
No, long
gauge.
25, long 25. Thank you. Injecting lidocaine.
Pressure down, 60/40.
Right. Wait, you can't ultrasound in place.
I know, that's why I'm taking the probe. 18 gauge thin wall on a 60 cc syringe, please, Dr. Collins. Let's go. You're going in right over the center of my probe. Advancing very slowly, looking for the hyperechoic tip. Very, very slowly. Do not hit that hard. Dr. Santos, you see that sea of black? That's the effusion. We're looking for a little white dot. There it is.
Got it. Aspirating.
3 cc should be enough. Good. Next, we'll place the guide wire and then the triple lumen catheter.
Pulse ox is 99. Pressure's up, 124/78.
Looks like things are back to normal.
That was cool.
4 Zofrans on board.
That should stop the nausea.
David, have you had any vomiting?
No.
Anyone else sick at home?
It's just us. My husband passed away a few years ago from COVID.
I'm so sorry.
Potassium 3.1.
Is that bad?
It can cause heart problems, but we're gonna correct it. Okay, 10 in the bag, 20 PO. Johnny, any questions?
David, have you two traveled out of the country recently?
No, I never go anywhere. Is she gonna have to stay here?
If the rest of the tests are good and she responds to treatment, she can go home.
What a douchebag! What a douchebag! What a douchebag! I don't know anything about the story, but as soon as... So... Oh my god. Boy, if you don't look at me straight, I'ma fuck you up. Look at me straight. I'm talking to you, bitch! Bam! Like, across the face was... Ugh! Ugh! Like, I hate that kind of energy. I don't want to be here. Then fuck off, dog!
My name is Dennis Whitaker. I'm one of the student doctors here. I'll be seeing you first.
Nice to meet you.
BP's 150/90.
Okay, that's just a touch high.
I forgot to take my damn enalapril this morning.
Oh, we'll get that for you.
Well, the exam is pretty benign. I'm gonna test for gallstones. If there is a stone and you eat fatty food, there can be pain when the gallbladder contracts. Oh, bingo. 1 stone, there it is.
Do I need surgery?
You should be able to manage with a low-fat diet, but we'll send off labs for liver and pancreas. Just let us know if you have any more pain.
Okay. Thanks.
Yeah, you bet. Great.
You want an EKG?
For,
Heart attacks can present as upper abdominal pain.
yeah. No, yeah, that's a great idea. Thank you.
Nurses, bro. Nurses. The backbone of society. What's a
I'm going as fast as I can. I'm picking up 2 more
I didn't
patients.
say anything.
I need a friend.
I swear to God, this mic, if it doesn't stop cutting off, I'm a rage. I'm a rage.
Fresh set of eyes.
On what?
54-year-old woman brought in with intractable vomiting by her 18-year-old son. I'm getting a weird vibe.
How so?
I don't know, maybe she was given something, some sort of elder abuse. It's just a strange dynamic I can't quite figure out. And you're really good at sussing out that sort of thing.
I don't know about that.
No, he's still fast asleep.
Most of the lab results are in and they look great. No abnormal blood count, no electrolyte abnormalities, no diabetes, no kidney disease, so.
Good. So what's wrong with him?
We're still trying to figure that out.
Did he have a play date yesterday by chance?
No, he had preschool, but he was fine when I picked him up.
Any kids in his class ill?
No, my phone here would have lit up if someone else was sick.
He eat anything this morning?
No. Why?
It looks like some sort of gelatin. Any chance he could have gotten into some bath beads or laundry pods?
No, and there's no such thing in our house.
What about gummies?
No, we're very strict about candy. Right?
Shit. Danny.
What about Danny?
Your brother, he gave me some gummies he got in Cleveland. They were in my coat pocket.
Are you fucking serious?
Pot gummies?
Yes. I'm so sorry.
Let me call the lab. Maybe the tox screen is back. Hey, this is Dr. Langdon from the ED. Can I fast track a lab on a little boy, last name Jones, first name Tyler, tox screen?
Walk out! I mean it.
Why don't we step outside and maybe you can help me figure out how much he may have taken? Thanks. I appreciate that quick turnaround. Labs confirm it. Your son tested positive for cannabis.
It's a fucking nightmare.
Teresa. David, this is my attention.
The mic doesn't work, you know? It decides. You see, you touch it, green. The fuck is going on? I hate this fucking mic. Don't buy it.
Dean, Dr. Rubinovich.
Hi, Dr. Robbie. We need to do a pelvic exam. And David, I don't think you want to be in here for that.
Definitely not.
Can you have Nurse Perla come join me, please?
You want a coffee or a soda or something?
Why do I need a pelvic exam?
You don't. Your son seems like a nice kid. He's clearly worried about you. But your exam and your labs are not matching any of the usual diagnoses, so I'm not really sure what's going on.
I'm not here for me. I'm here for David.
I don't understand. He said that you've had persistent vomiting, some
I made myself
dehydration.
sick with Ipecac.
To induce vomiting? Why would you do that?
So David would bring me here. My son has some problems. He needs professional help.
Okay, what kind of problems? Drugs, alcohol?
I found some of his writing. I thought it was schoolwork, but it wasn't. It was lists of girls he wanted to hurt.
Go to the cops. Why you coming here? Have a therapist.
Hurt them how?
He said they should all be eliminated.
The next generation of
see a
Epstein.
therapist?
No. He's not a bad kid, but I'm afraid he's troubled. And I didn't want to call the police because I was afraid they'd overreact. He's just a kid.
How old is David?
He just turned 18 last month.
Not a kid anymore.
Then he's considered an adult, and he would
Yeah.
have to consent to treatment. Do you have any guns in the house?
No. My husband did, but I got rid of all of them after he passed. He's a good soul. I just don't want to see him hurt anyone or himself.
How you feeling, Crash?
Put him down.
I'd really appreciate it if you
We
didn't
don't need another pedophile.
It's a cool nickname. You earned it. You should own it.
We don't need another Epstein,
I
bro.
don't like it.
Put him down.
It's just a joke. You know, if it makes you feel any better, I sharded the first time I saw an emergency C-section.
Valid.
Really?
No.
Of course not.
Yeah. Dickhead.
Excuse me, I'll be right back.
I got a situation. 18-year-old kid brings in his dehydrated mom. Dad died during the pandemic. Mom's vomiting is self-induced for the sole purpose of getting him here after she finds his death list for classmates.
Okay. What does she want us to do?
Help him, protect him, save him.
Where is he now?
Talking to McKay.
How are you doing?
Me? I'm good. I'm always good. You know that.
Do I? Does anybody?
I'm an open book.
Not even close. You do know you can always come talk to me,
Yep.
right?
How's it going over here?
Good, good. We're just going over aftercare instructions, prescription medication, special diet for the next few days.
Dr. McKay, can you check with the statics on Mom?
I can.
David, I wanted you to meet Kiara. She's a social worker here who helps in situations like this. We heard about your father's passing. We're really sorry. And we know that can put a lot of pressure on somebody your age, which combined with school and now having to take care of your mom, that's a lot.
It's fine.
We just want to make sure that when your mom goes home, you can handle it. We want to make sure you have someone you can talk to if you need to.
I'm okay. I don't need to talk to anybody.
After a parent dies, the sadness can last a long time. How's that going for you?
It's not a problem.
What about school?
What about it?
Anything you enjoy there?
Not really.
A lot of people have thoughts that can disturb them. If you've had any, it's okay to talk about.
What's that have to do with my mom? Is she gonna be okay?
Yeah, she's gonna be fine. She's probably got a stomach virus, maybe food poisoning. I think she's more worried about you.
She always worries about me.
Does she have a reason to?
No. It's almost 8. I gotta go.
Sure you wouldn't prefer to wait with your mom?
I'm late for school. She can just call me when she's ready.
It would actually be kind of helpful to talk to you some more. Hey, David? David. Hey, just give me 5 minutes. Leave me alone. Hey, David!
Robbie! Robbie! Got a college kid, respiratory arrest, coming in hot.
How would you do in that situation? Genuinely, right? You know this kid is fucked up. Hello. I'm sorry that the volume has been lost in this 5 seconds, but I'll repeat it again for the viewer. Huck this microphone, by the way. Would you help this kid or would you let him go? That was the sum of my conversation. Would you help him? Would you go out of your way to help him? Or would you be like, nah, let the cops deal with it? What would you do?
Robbie, we need to intubate here.
Dr. Adamson just went down with a pulse ox of 65.
Oh shit, this is during COVID. Damn. Listen, that was a great episode. That was a great episode. I talked during it. I'm sorry for those of you who don't like to enjoy movies with conversations. Ah! Fuck this mic. Fuck this mic, dog. Fuck this mic. You know what? I'm gonna keep it short because I don't know what the fuck is gonna do after this. Love this show. Gonna continue it. Doses. Have a great day. Fuck you, dog. Fuck.